What about the health service? The NHS Confederation represents NHS employers. They too are affected, I guess. Its senior advisor on finance and regulation is Paul Healy. Hi, Paul.
Hi there. Good morning.
What are the figures for you?
So, the NHS is particularly affected by the change because it has 1.4 million staff who are on who get the state pension. When you look at the public data available, we've calculated it about 1.1 billion for the NHS in terms of the loss of the rebate and how much it will cost them.
Right. See, we had this great argument about how the NHS needed more money and the government was committed to spending more money, but this kind of puts a bit of a dent in that, doesn't it?
Yeah, and it's hard to be clear whether or not the Treasury have talked about whether or not the 8 billion figure, which comes from the 5-year-4 review document from NHS England, includes this cost pressure. Nothing in the actual analysis that's publicly available suggests that it does. Most of the increase in costs on the NHS is around demand, around more people turning up at hospitals and a kind of ageing population that means that people have more long-term conditions. So there's nothing really to suggest that we've been able that analysis has actually kind of considered this additional cost.
I don't know quite how you do budgets in these circumstances because, I remember during the election everybody wanged on about the health service needed a lot more money and then they promised vast efficiency savings and the government promised lots more money. But how do you drop a budget when all these are imponderables, really? Yeah,
I expect a lot of organisations in the NHS have been preparing for this cost pressure because the government's been quite clear of employers that they do need to plan for it. But the problem for the NHS is that there's two real challenges for them to be able to plan. The first is we don't actually, like a lot of public services, we don't actually know how much money the NHS is going to have from April 2016. We won't find that out until Wednesday in terms of the spending review. But also, if we look at some of the latest financial data in the NHS, we're seeing that huge amounts of deficits are growing in the NHS, and actually one of the main contributions to that is unplanned spending on pay, mostly around agency spending.
Yeah.
So even if organisations have been looking to plan financially, there's a lot of things that will actually make it harder for them to actually be able to do so.
Right. Are we going to stagger through this, or are you worried by the situation?
Well, I think our main concern is how this will disrupt the kind of medium and long-term planning in the NHS, because many of our members will have no other option but to prioritise these short-term pressures because they'll have to make their budgets balance, and so that will probably delay or postpone some of the investment that we need to deliver that 5-year-4 review vision, to invest in the services that are new models of care that are better suited to patients' needs today. And if they've got immediate pressures that they have to manage from April 2016, and it's not just this, there's other pressures as well, then they may be no other option but to kind of almost forego those in order to make sure that current services are sustained.
Right. Thank you. Well,